Hello, everyone. My name is Naud Volders, and together with Associate Professor Naim Gerliu from the University of Pristina, we studied health literacy and chronic disease self-management among older adults in Pristina, Kosovo. As Kosovo's population ages, understanding how older people manage long-term conditions becomes increasingly important, especially since health literacy is key to effective self-care. Health literacy refers to the people's ability to find, understand, and use health information to make everyday health decisions. While we know it's linked to better health outcomes, its role in Kosovo's older population hasn't been well studied. Our goal was therefore to explore how health literacy influences chronic disease self-management among older adults attending community centers and NGOs in Pristina. We conducted a mixed methods cross-sectional study with 89 older adults. Health literacy was measured using the HLS EU Q16 and chronic disease self-management using the SCCII version 3A. We also included qualitative interviews to better understand participants' experiences, especially barriers to accessing and using health information. On average, participants had moderate health literacy with a mean of 3.12 and moderate self-management with a mean of 6.6. We found a significant positive correlation between health literacy and self-management. A regression analysis confirmed that higher health literacy independently predicted better self-management, which explained around 20% of the variance. In the multivariable analysis, several interesting patterns emerged. Higher education was significantly associated with lower self-management, suggested that more educated participants reported slightly less self-care. Diabetes was associated with higher self-management scores, and reporting an unspecified chronic condition was linked to lower self-management. And the number of chronic conditions was positively associated with self-management, meaning that people managing multiple conditions actually tended to perform better in their self-care routines. The qualitative data provided context. Participants often reported difficulties accessing clear health information, low digital literacy, and a strong reliance on healthcare providers. Many emphasized the need for more accessible materials and better communications from health professionals. These results show that improving health literacy alone may not be enough. Older adults need both accessible information and systemic support that addresses social and organizational barriers. Limited digital access, financial constraints, and inconsistent communication all affected people's ability to manage their conditions. So, interventions should target both literacy skills and structural barriers in the health system. To conclude, health outcomes depend on both individual capabilities and the broader social context. NGOs and community organizations are vital for translating knowledge into practical self-care. And lastly, public health strategies should combine health literacy improvements with system-level and community-based support to empower older adults and promote healthy aging. Thank you for listening, and I'd be happy to discuss our findings further or answer any questions about these insights. Thank you.